first of all, I want to just welcome everybody because we have people from all over the world. For those of you that are attending the webinar on Zoom, please just put in the chat area. We want to know where you're from, how many animals you've got, what their ages are. Just let us know. And the same with the people on Facebook Live. Just put a comment down there. If you're enjoying the webinar, send some little hearts and some likes. Let us know if you've got any questions. Just post them in the comment section or the chat session. And yeah, at the end, we're going to do a sort of Q&A. So we'll try and answer as many questions as we can, but time might cut us short a little bit. So yeah, let us know where you're from and if you're enjoying the webinar.
And Oli, I just wanted to say that we will be probably running about 2 hours, plus minus. We'll see how many questions we get. But I'm going to pass on the microphone and camera to Megan, and I'm really curious to learn as well from you, Megan.
Thanks, Peter. All right, so when you talk about pet arthritis, I think it's something that's really important that you guys all know is that there's no cure for arthritis. And then all we can do is really manage this condition. One of our goals is obviously to try and slow down the progression of arthritis. So if our pet gets diagnosed with arthritis, all we can do is just prevent any further damage occurring to the cartilage. And we're going to chat today about all the things that you can do to prevent arthritis in your pets. And if your pets are diagnosed, how to slow that progression down. Because if we don't, then their lifespan is definitely going to decrease. And I think most of you are here today because you've got an arthritic pet, and your pet might be struggling with movement. Maybe they're struggling to do sort of everyday tasks that they used to be able to easily do. So maybe jumping in and out of the car. You've noticed that your pet's getting up from a lying down position and really struggling, maybe struggling with its back legs, maybe struggling with its front legs. So pets get arthritis in all different joints, and they get arthritis in their backs, their necks, their elbows, their hips, their knees. So they're all different areas, and depending on where their arthritis is, it'll depend on how it impairs their life. So 1 in 5 dogs will suffer from arthritis and about 1 in 4 cats. And when I read this stat, I was actually quite interested because when I was at vet school, arthritis was something that dogs got, not something that cats get. And I think even when I was in private practice, I didn't really treat that many cats for arthritis. Another study that was done, they actually found that in the case of the number of cats that they had, 90% of the adult cats that they looked at, they x-rayed, 90% of them had radiographic, which means x-ray signs of osteoarthritis, but only 50% of those actually were showing any clinical signs. So what does that mean? We don't know that much about the etiology or the cause of osteoarthritis in cats and compared to dogs, but we believe that the process is similar. So are cats just really good at hiding their pain? And I think the answer is yes. It's instinctive for survival for our pets to hide their pain. And I think that possibly in cats, maybe we're really poor at picking up their pain, and maybe we're looking for the wrong signs. Pets don't indicate their pain the same way as people, because pain equals weakness. If an animal is weak, then there is less chance of them surviving. So our pet's health depends on the decision we as pet owners make. There's so much information out there, and especially now with the internet, there are YouTube videos, there are blogs, and it can be really overwhelming. When I have a look at all the things about arthritis, like 10 things, 20 things that you should be doing. So sometimes I think for pet owners, they just really don't know where to start. And that's where Peter and I really want to come in today. We really just want to give you some steps, some things that you need to do for your pets that are suffering arthritis to try and help them to improve their mobility and to increase their lifespan. So the things that your pet has no choice in, and you're the one who chooses these things for your pet. You choose what food your pet eats, whether it's raw food, pelleted food, grain-free food. You choose what supplements your pet gets. You choose how your pet is exercised. Peter's going to be covering a lot of these topics. That'll be later on, and some of the topics I'll also be covering. So one thing that is really important And it's just not one thing that we do. And so sometimes when I have clients that come to me with pets that have got arthritis, they want to know, they say to me, what is the supplement that I should use? They feel like there's just one, if they can just find one thing that's going to make their pets' lives better. And the problem is that there isn't just one thing. And in veterinary, we use a term called a multimodal approach. And that means that we approach it from all different sides. And for me, it really means that we approach it holistically. So we look at the whole dog or the whole cat. And so we look at all the nutrients, we look at the supplements, the exercise, the environment, the pet's weight. We look at its pain management, whether it be natural or drugs, and we look at all other treatments that we can do to help that pet. But we need to focus on first things first. And I think that one of the problems is that majority of pets that get diagnosed with osteoarthritis, you'll notice that your dog is struggling to jump into the car. You take your dog to the vet. Usually they get an x-ray. And majority of vets, first thing that they will prescribe is a 14-day non-steroidal anti-inflammatory course, because these dogs are in pain and discomfort. And if you have a look at this pyramid that I've put together, you can see there's a whole lot of things that we should be doing way before then. For example, weight management. You know, I think Peter's going to be talking about and give us tips on maintaining the optimum weight. But I just wanted to highlight how important it is and how it impacts on your pet's mobility. Studies have been done, and they've looked at dogs, and they've found that 50% of dogs are overweight. And if 80% that actually lose weight, so if a dog loses weight, 80% will have improved mobility. And just that alone means that you need to do this. You need to make sure that your dog is in the optimum weight. If there's an 80% chance that your dog's mobility will improve because you have put it onto a weight loss program. And the studies that have been done, they've said that 6% weight loss will significantly improve a pet's gait. Another study also done, it was done in 2010, they looked at a lifelong diet restriction, keeping a pet lean as possible for its whole life. And they showed that by maintaining that, it was associated with a slower onset of osteoarthritis in dogs. And, you know, weight is a problem because, first of all, it overloads the joints and it overloads all the soft tissues around them, so the ligaments and the joint capsules, because the extra load that gets transmitted through those joints. But another problem is that adipose tissue is what we call pro-inflammatory, and it means it releases like a hormone-like substance called cytokines, which cause more inflammation in the body. So the next thing is nutrients and supplements, and Peter's going to be covering this. The environmental changes I'm going to be talking about, but towards the end of my lecture. And just a few changes in your pet's environment can really make a big difference. Rehabilitation. If you're lucky enough to have a veterinary rehab therapist in your area, I would highly recommend that you schedule an appointment with them. They can do a rehab assessment and treat and make suggestions tailor-made for your pet. And things that they would do are things like laser, physio, hydrotherapy, acupuncture, massage. Exercise. This is a large part of my talk today. And I'll be talking about the importance of exercise, and not just about your pet and how you take it for walks and where you take it. We're going to be talking about therapeutic exercises. And these are exercises that are targeted to strengthen the muscles that help to support your pet's joints. Alternative therapies are things like magnetic therapy, homeopathy, herbal medicine, essential oils, acupuncture, chiro. I think Peter's going to chat a little bit about that. But, you know, there's so many things that we'd love to chat to you about, but we've really just chosen and highlighted the things that we really think are going to make a major difference. Only once you've gone through all of those, then you start looking at medications and surgeries and other therapies. And medications, we know that these medications have side effects, so we really want to try and minimize the use of medications and any invasive techniques that we're going to use in our pets. So this is just a quick run through of what I'm going to be talking about. If you gave me a chance, I could be talking for hours and hours and hours. So I've had to choose a few things. And I'm just hoping that this will give you enough information that you can actually start implementing these things today in your pet's life. And if you do these, I think you're going to very, very quickly start seeing improvements and results in your pets. So let's start chatting about what arthritis is and how it's caused. So arthritis is inflammation of the joints. So the word artis is inflammation and arth is joints. And it can be caused by general wear and tear, which is probably one of the most common reasons that pets get arthritis. But it could also be from an injury. So for example, if a dog got hit by a car, it could be secondary to an existing condition. So for example, if a dog had hip dysplasia, they're more likely then to get secondary osteoarthritis. And then also if a pet has any joint surgery, any interruption to the joints, especially if you go into the joints and cut through the joint capsule, disturbs the joint, and then it makes it unstable, and then there's a likelihood that there is arthritis is going to form. But the bottom line is that basically there is damage to the structures that hold the bones together. And if you look at this picture over here, so there's the one bone, there's a layer of cartilage that goes on each side of the bone. And then the soft tissue structures, there's a capsule and ligaments that go around. They span between the two bones. And these are really important to keep the joint tight and make sure that these two bones actually glide together very nicely. Once there is some damage to these tissues, so whether it's wear and tear or injury, then these two bones don't glide so well together. There's a little bit of movement and maybe there's some sideways movement. And what happens is the areas of cartilage start to rub irregularly. And once the cartilage rubs all the way, it exposes the bone below. And this is called the subchondral bone. And that's when it starts to get sore. The subchondral bone releases all these inflammatory mediators and it releases them into the joint. And this sets off a whole cascade of events. And when there's inflammation in the joint and instability, the body actually tries to deposit bone. And some of you might have seen some x-rays of your pets. Maybe your vet has explained to you, showing you little things called osteophytes. And it's little bits of bone that deposits on either side of the joint. And this causes even more pain because this capsule or the ligaments and soft tissues push against these bony areas, really causing a lot of discomfort. And the body actually does this because it's attempting to try and stabilize the joints. But it takes a long time for it to stabilize the joints. And what it eventually wants to do is just to bridge right across to form stability. But this often doesn't even occur, and only in certain joints will we actually see that the bone completely bridges. So once these inflammatory medias being released and all this inflammation is there, we have a few things that happen. So the one is that there's obviously pain and inflammation. We get decreased ability of the pet to be able to bend and straighten its joint. We get a decreased quality of life because of the discomfort that they have. And also our pets don't live as long because they're not able to actually be able to move around. What do you think the most common reason for euthanasias in animals is? So a study that was done, they found that 68% of pets are euthanized because of poor mobility. And I was really shocked when I actually read that, because these pets are healthy otherwise. And I can remember, pets with their owners coming into my practice, and they were carried in. The dogs had no muscles on their legs, and the owner would always say to me, everything else is fine. My dog is 100% healthy. It just can't walk again. And it's really sad. It's really sad to see, because I know that there's a lot that their pet owner, if they had actually known and they had the knowledge, they could possibly have prevented. So what are our goals in these cases that we are, and our pets that have arthritis? So we want to reduce their pain and discomfort. And we can do this by things like massage, acupressure, and natural supplements where possible for pain management and treatment. We want to maintain healthy cartilage, because we know that as soon as that cartilage has gone down to the subchondral bone, then all those inflammatory mediators are going to start being released, and they're going to set up that inflammatory cascade. So we want to slow down any damage or deterioration in our cartilage. We also want to slow down the progression of the disease. In humans, exercise therapy is considered actually like the cornerstone of management of osteoarthritis. And studies actually show that muscle weakness in humans is a predisposing factor for the development of arthritis. And this is why I believe that therapeutic exercises should be done actually from as early as 12 weeks of age. And in South Africa, I have workshops around the country where I teach pet owners basic exercises, therapeutic exercises to improve muscle strength from a very young age. And there are a lot of people and practices that have implemented this in their puppy classes now in South Africa, really starting from a very, very young age to make sure that our pets are strong so that we can decrease the chance of them getting osteoarthritis. Another study done in humans with knee osteoarthritis, they found that therapeutic exercises were actually effective for pain relief. And they also found that when specific muscle groups are weak in people with knee arthritis, the people had higher pain levels and they also had poor physical function. And if they'd actually, afterwards, when they strengthened those specific muscle groups, there were major improvements in the pain and mobility of these people. So without mobility, if I think about a pet, like what kind of life do they have? And I think about my dogs, and I'm not sure about your dogs, but one of the most exciting things for my dogs to do is to go for a walk. That's the first thing. And then I think probably second would be their food. And then third would be like a tickle or scratch or a love from me. But their daily life revolves around their once or sometimes twice daily walk that they go on, and they live for this. And I think if I had to take that away from them, if their mobility was so impaired that they couldn't do it, I think that they would be really sad, and it would really take away from their quality of life. And I think it's the same for people. If you don't have mobility, if you think about somebody who's paralyzed, they're dependent on others, and things that you're able to do, you're not able to do as many things as you'd want to. So if we want to maintain our pets' quality of life, we really need to make maintaining their mobility a priority. So we don't really know what the mental and psychological dimensions of pain in animals is. But one thing we need to consider, and I mentioned it earlier, is instinct. Because the instinct tells them to mask their pain. So often the clinical signs of osteoarthritis only actually become evident when this disease is in its advanced stages. Also, sometimes signs of pain can actually even be masked by other behaviors. So if you think about a dog that is arthritic and is in pain, the dog will wag their tail and they'll come and greet you despite being in pain. So they're actually easily able to mask their pain. And I don't want to get into too much theory about pain today because I've still got so much I want to talk about. But pets display their pain basically by changing their behaviors. For those of you that are interested in this topic, we had a really great webinar in December. You can access for free on my website, drmegankelly.com. And it's about how pain influences behavior. It's free. You just click on there. You can sign up for that just to find out more information about pain and behavior. So I'm going to show you a little video now. It's called a weight distribution test. And it's a very easy way for pet owners to pick up signs of arthritis in the early days. So before you actually really notice that they're limping, and a real sort of classic type of limp. So sometimes when pets have just got a little bit of discomfort, to the untrained eye, you might not even notice that they're limping. A really easy way to pick up early signs of arthritis is to have a look at your pet's weight distribution and their posture. So when a pet has some joint pain, they will alter the way that they stand, and they alter the amount of weight that they will put on that affected limb. And so we can do a test called a weight distribution test, which determines how much weight a pet is putting on each limb.
In veterinary hospitals, we have things called force plates, which analyze the amount of weight distribution, but pet owners in small veterinary practices don't have those kind of tools, and we have to use what we call the weight distribution test. Sometimes these changes in these pets' weight distribution are so subtle that we actually probably wouldn't even pick it up as a lameness. So a normal dog would take 60% of its weight on its front legs and 40% on its hind limbs. That means 30% on each front leg and 20% on each hind limb. If that pet had a problem with, for example, its left hip, it would have decreased weight bearing on that left hind, and it would shift its weight either onto the right front, so across the diagonal, and a small amount of weight also onto the right hind. So to do the weight distribution test, you're going to get your pet and make them stand with their feet directly underneath them. And you're going to gently put pressure backwards on their limbs. So you can see what I'm doing here. This is actually my dog, Sunshine. She is a rescue. We rescued her about 6 months ago, and she has hip dysplasia. She's about 18 months of age. And you can see as I'm putting a little bit of backward pressure on that left hind limb, you see how that leg starts to pull backwards, and you can see that she's actually not putting weight. She's putting weight on all the other 3 limbs, but that left hind limb, she's not putting weight. So she's shifting her weight onto her right front, putting a little bit more weight onto her right hind, and really not putting weight onto that left hind leg. So this change in the weight distribution has consequences on other parts of the body, because there's an increased load now on the right front leg and the right hind leg. So increased load on all the supporting structures like the ligaments and the joints and the muscles. Now, if we have a look at Sunshine running around here, to the untrained eye, it would be difficult to actually pick up that she had a left hind limb lameness. And so that weight distribution test is a great test, especially for pet owners, to pick up subtle signs of joint pain.
All right, and here's another example. If you see this dog walking here, just wait for it to come again. See here, if you have a look at its left hip, you can see how it's walking with its left hind leg out at a strange angle like that. So that dog's got a very sore left hip. So what it's doing is it's shifting all that weight onto its right front and also onto its right hind. And you can see how it swishes its tail, and it's swishing its tail mainly to the left side. And it's overusing its back instead of using that left hind leg properly. So let's have a look at this dog a little bit closer. So if you have a look, you can see there's a lot of muscle wastage here, just from that dog not using that leg properly. And even just the way that it's standing, you can see that it's putting its leg slightly out to the side. So it's putting a lot more weight on this right hind, and it's putting that leg out like that so that it doesn't have to distribute weight through into that hip. This muscle over here in its back will be very, very tight and in spasm, because instead of using the leg properly, it overuses its back to try and advance the hip. And what was really interesting is when you took a picture of this dog from above, you can have a look at the spine. Do you see how curved the spine is here? This muscle here in this dog was so tight. If you actually palpated that muscle, there were so many muscle spasms and trigger points there. And so these tight muscles and overused muscles, you can see how it impacts on the rest of the body. And this spine would be under a lot of stress, all the little ligaments and all the joints. And that's a problem, because this is the problem. When we have pain in one area, we have consequences in other areas of the body. So when we have this compensation from pain, we get 2 things. We get one, which is tight spasming muscles, which become overused, and we get loose flabby muscles, which are underused. So those tight overused muscles, so those in that dog would be in the dog's back. The problem with these tight spasming muscles is that they impinge on structures below. So there sometimes will be little nerves that will go between the muscles, and they can cause a lot of pain and discomfort. They can also pull joints out of alignment, which results in joint imbalances. And this will obviously cause arthritis in other areas too, because the cartilage will start to rub irregularly. And overall, these tight muscles just cause your pet more pain and dysfunction. So the weak underused muscles, so that would be in the dog's hind leg, One thing that people don't often think about muscles for, when we think about a muscle, we think about that it contracts to allow us to do movement. And there's another function that's really important, and that is joint stabilization. And when these muscles waste away like this, they're unable to perform their function of joint stabilization. So the less support your pet's joints have, the more arthritic they'll become. So when we look at joint stability, we've got two main types of joint stability. One is static joint stability. So that's how well the two bones fit together, which we call joint congruency. Then we have the joint capsule, which is the capsule that surrounds the whole joint. And then we have the little ligaments that span between the two bones. Now, if there's injury or wear and tear to the joint capsule or ligaments, or the joints don't fit so well together, there's not that much that we can do about it. Unfortunately, ligaments don't have a very good blood supply, so they don't heal very well. And when they do heal, they never regain the strength that they used to have. And if a ligament actually gets damaged, if you have a ligament tear, it actually takes a whole year before it actually heals enough to have the tensile strength to be able to support that joint. The other type of stability is dynamic joint stability, and those are those muscles that are around the joints. And contraction of these muscles really helps with stabilizing joints. And really, that's where we want to focus with. We want to focus on muscles and how muscles can help us provide support for our pet's joints and decrease or slow down the progression of our pet's arthritis, because we can't do much about that static joint stability. So this is another case study. It's a dog that's got hip dysplasia. You might be wondering why I'm showing so many pets with hip problems. And the reason being is because it's really easy for pet owners to see when there's a lameness. And it's also an area, there's a major amount of muscle that surrounds hips. So the glutes are very big muscle mass, and so they offer a lot of support for the hip joint. So it's one of those conditions, if we have hip arthritis, where we see results very quickly. So this is a dog walking in the underwater treadmill, and you'll see just now how it starts to go from side to side. And so it actually walks with a waddle, and we call that the hip dysplasia waddle. And it does this because they don't like to pull their leg back. So as the treadmill goes backwards, it actually pulls the leg back, and we call that extension. And that's painful for them. So what they do is, instead of using their hips to extending their hips, they contract their backs to get their leg forward. And this is why we see this little waddle type of hip dysplasia waddle. So they overuse their back muscles, and the muscles in their legs become underused and wasted away. And the more they do this hip dysplasia waddle, the more wasted away they become, the more unstable the hip becomes, and the more pain. Right, so now when pets start walking in this way, once they start compensating and changing the way that they walk, eventually this actually becomes ingrained in the pet's motor cortex. So it becomes actually their normal way of movement. This is a problem because when we take our pets for a walk, we think that our vet has said to us we need to exercise is important, and we think that when we're exercising them, they're getting this muscle strengthening. The problem is that majority of them are walking in this compensatory way. So they're using the incorrect muscles because their body thinks that this is the way that they should move. They've been moving like this for so long, it becomes their normal gait pattern that and the way that they work. And so walk. So even if they are taking their dogs and exercising their dogs, these muscle imbalances just continue to get worse because of this compensation. So this is a little sort of flow chart that I put together. The normal sort of approach to osteoarthritis, and I talk for myself now. Before I became a rehabilitation vet, I think when I first qualified, if a pet came in with arthritis, the first thing we think about is pain. So that's our main focus. We focus on managing the pet's pain. But the thing is that joint instability is the reason that we have pain. So we have a joint instability, which causes pain, which then causes the pet to compensate or alter the way that they walk. which causes these muscle imbalances. And we get weak, wasted away muscles, and we get those tight muscles that start to go into spasm. And the problem with this is that the weak muscles cause more instability, and the tight muscles cause more pain. Our sort of general approach to these cases, so before I did rehabilitation, just focusing on the pain, one would think if you gave a non-steroidal anti-inflammatory or painkiller, then we could break this whole cycle here, because we'll break it there. If the pet has no pain, then it won't compensate, and we can break this whole cycle of deterioration. But the problem is that these faulty movement patterns are ingrained in the motor cortex. So it doesn't matter how many painkillers or anti-inflammatories we get, these pets are still walking in the incorrect way. And this is a reason why a lot of pet owners, when you have a dog that has arthritis, you might start off giving an anti-inflammatory every now and again, and then eventually you start giving it every single day, then you give it twice a day, and then you need to add in other pain medications on top of that. And it's because that this cycle continues, and the more we have muscle imbalances, the more we have tight muscles that are in spasm, the more pain we have to treat, the more wasted away the muscles become, the more unstable, and the more pain we have to treat. And it just carries on with more and more pain. And that's why we need more and more painkillers. So until we start to focus on the muscle imbalances and start treating these weak, wasted away muscles by strengthening them, and start treating these tight muscles in spasm, we are going to continue with the cycle. And what we eventually need to do is to break these compensatory patterns and try and get the pet to start walking in a more normal way. And as soon as we do that, we will have less pain to treat, because the stronger the muscles are, the less unstable, the more stability the joint will be, and the more stable the joint will be in, the less pain your pet will have. So how do we correct muscle imbalances? Well, if you are lucky enough to have a rehab therapist that lives close by to you, the rehab therapist will be able to manage all of these things. They can do things like acupuncture, massage, they might do laser, heat therapy, so looking at those tight spasming muscles. But it doesn't mean that you, the pet owner at home, can't also do these things. I teach all my pet owners how to do acupressure, how to do heat therapy, and how to do massage, which they do between treatments to make sure that we maintain that pet. I've developed an online massage course, and I have an e-booklet. I'm teaching pet owners also how to do all the acupressure points. Now, when we're looking at those long, weak muscles, the rehab therapist might have an underwater treadmill. They might use electrical muscle stimulations, which is a machine that causes muscle contractions. They'll do therapeutic exercises, and they'll do advanced as well as simple exercises. But we'll also give the owner some simple home therapeutic exercises to do at home. And now I'm not talking about balancing on balls and wobble boards and things like that. And that's why I've put here advanced and simple. If you are working together with a rehab therapist and your pet has the base strength, that they are then progressing with a rehab therapist to balancing on balls and doing all those kind of things, and the rehab therapist is happy for you to do those type of therapeutic exercises at home, then under their supervision you can. But I would always recommend just to do simple exercises. I see on YouTube all these different exercises, and it really worries me, because you can actually do more harm by doing an exercise that your pet is not strong enough to do when it has arthritis. We really are going back to basics. These are very basic exercises that we want you to do. So talking about massage, massage helps with the human-animal bond, and I have so many clients of mine that will send me feedback back about they've done the online massage course, or they've attended one of my massage workshops, and they've used it on rescue dogs that are very anxious, and massage just really helps with that connection. It also allows you the opportunity to be able to palpate your dog, to feel any lumps and bumps, and just to be a lot more connected whenever you might palpate that there's a bit of heat or maybe a problem or some pain that your pet has. But the main reason that we massage pets is to try and improve blood flow to those tight spasming muscles. And the problem when a muscle is in spasm, it causes a lot of pain and discomfort. In a healthy muscle, when the muscle actually relaxes, that's when blood flows into the muscle. Then the muscle contracts and the blood moves out of the muscle. So oxygen needs to come into the muscle and all the waste needs to be removed. So a muscle that is tight and spasming, there no new blood can come in, so no new oxygen can come in. Those toxins can't be removed, so the toxins just accumulate there and just create more pain and more dysfunction for the pet. And the problem is also that there'll be certain areas that will be really, really, really tight, and this impairs their joints from actually being able to move properly. So when a muscle is tight and spasm like that, the range of motion or the ability for a pet to be able to bend and straighten its joints is not as good as it should be. It also stimulates endorphin release, which is our body's natural healers, and promotes venous and lymphatic returns, just getting rid of all those waste products. So how do we strengthen pets? Well, we can do therapeutic exercises and hydrotherapy or underwater treadmill. We can do hydrotherapy as in swimming, but one thing that's important is that the dog actually needs some partial weight bearing in order to activate the specific muscles that help to support pets' joints. And these muscles are their extensor muscles. And in the pool, when they're swimming, these muscles aren't activated. They need weight bearing to activate them. And that's why if you have the opportunity, an underwater treadmill would be my first choice of hydrotherapy. So why are these exercises so effective? Well, they activate the correct muscles to support the pet's joints. And they're subtle enough that the exercises is actually, they spare the joints. So they're not so hectic that they cause pain and discomfort in the joints, but they're still working the muscles. And you're able to exercise your pet in a controlled fashion so that there is little chance of injuries. It's easy to adjust the difficulty depending on the strength of the pet. It can be done in any age pets with any condition. Like I said, from 12 weeks of age, a lot of these exercises should be done. And a lot of therapeutic exercises, that the ones that I'm going to be chatting about, actually don't need any equipment. This is a dog that's got severe muscle wastage. And when I look at this, I can actually just see the pain in that pet's hip. I can just see in its knee. You can just see that there's no support there. So just to summarize, we really want to strengthen all these muscles to help stabilize the knee and to help support the hip and the rest of the body. All the muscles, we're going to be doing exercises that target all the muscles that support all your pet's joints.
Exercise is the weight shifting exercise. You get your pet and make your pet stand with its feet hip width apart. Put either hand on each hip, and you're going to rock your pet from left to right leg, taking a little bit of weight on each leg. You don't want to push too hard so that they step to the side or fall over. Sometimes some dogs will try and move to the side if they're trying to cheat. If they do this, then you can put either leg on either side of them and use your knees to actually move them from side to side. This prevents them from stepping to the side or cheating. Some dogs, especially if one leg is more sore than the other, will avoid trying to put weight on that leg. If that's the case, then you can do as this lady's doing here, with your hand pushing some downward weight on the leg and pushing the dog onto that left leg that's affected. This exercise is really great for building the extensor muscles. These are the muscles that are important for stabilizing the hip. And in this video here, you can see the muscles contracting really nicely.
So that was the first exercise, the weight shift exercise. And please don't worry about trying to take notes or anything like that. I'm going to give you guys access to all of these videos. So you'll have free access to them. So just concentrate on the exercise, what we're doing, and just listen to the audio.
Or the weight shoves exercise. It's one of my favorite exercises. I think it's really an all over body workout. So with your dog standing with all 4 feet underneath, you're going to push it from front to back, and as another challenge you can do is from the left hind to the right front, so on diagonal, and you can swap and do it from the right hind onto the left front, and forwards and backwards. So great exercise in this dog. You can see those front muscles, the abdominal muscles, as well as the back legs, so all the muscles contracting. It's really, really a good workout in a really controlled fashion.
So that weight shoves exercise, that is a complete all over body workout, one of my favorite exercises. The next one is the hip bounces.
Called hip bounces. You're going to get your dog to stand with its feet hip width apart, similar to how we did the weight shifting exercise. See the handler correcting the paws to make sure that they're directly underneath the pelvis. And with both hands on top of the pelvis, you're going to push directly downwards with a downward pressure in a bouncing fashion to try and get the dog to take weight on those back legs. Your dog should resist against you, so should try and counteract the force that you have pushing down on their back. And you're going to have a look at the muscles on the sides of their legs to make sure that you can see muscles contracting there and to see that their back legs are working well.
All right, next
You're
one
getting your dog to stand on 3 legs by lifting one paw at a time off the ground. And you probably need to support your dog initially. So with one hand underneath the abdomen, support the dog, and holding the leg sort of between the paw and the ankle, you're going to lift the dog's leg up so that it's taking weight onto the opposite leg. Initially, just lift the dog's leg just off the ground. The higher you lift it, the more weight is going to be put onto the opposite leg, and the harder it is going to be for your dog. Some dogs might cope with maybe 1 second, others sort of 45 seconds. Remember, this is quite a challenging exercise, taking weight onto only 3 legs, and it may take time for your dog to build up some strength. Some dogs, as you lift their leg, are just going to put all their weight onto your hand. If they do this, then this is a little trick. You can just, using the other hand, tap onto their paw, and this will help to get them to distribute their weight onto the front legs and onto the opposite leg.
All right, so that was the leg lifts, so now this is the paw shakes. So going on to the front legs. And with those leg lifts, you're going to do each leg. So you're going to lift the left front, the right front, the left hand, the right hand. So you're doing all the legs.
Paw shakes. This exercise is similar to a high five. With your dog sitting facing you, you're going to get them to lift their paw and give their paw a shake. And you're going to do both the left and the right paw and giving them a treat. Great exercise to increase flexibility and mobility of your dog's elbows and shoulders. This exercise is called side bends. Basically what you're going to do is, using a treat, you're going to try and feed your dog towards the one hip and then turn around to feed them towards the other hip. And you may need to use one hand to actually stop them from turning around. Otherwise, they'll just swing their hindquarters out. So you can see the handler's got their left hand up against the hips and using a treat, trying to get their dog to eat as close to the hip as possible. And now what that's doing is helping with stretching of the back and helping with weight bearing and improving muscle activation in those hind legs. And you want to do it on each side.
And this is the last one of the 7 exercises.
Stand exercise. This is a great exercise for building hind limb muscle strength. You get your dog to sit down and to stand up. If they need to, they can take a few steps forward, otherwise just into the standing position, and then get them to sit down again. Try as much as possible to get your dog to be as straight as possible with its legs directly underneath it. So as they stand up, they're putting equal pressure on both hind legs.
Now with that last one, that last sit to stand, if your dog is arthritic in a knee, often what they'll do is they'll sit with the one leg out. And maybe some of you have noticed that. What you will do then is you'll get your dog up against a wall with the side that they stick the leg out, and then you'll do the sit to stand right up against the wall to prevent them from putting that leg out. It's really important that they have their hind legs and their hips their legs underneath them so that they can push and contract the right muscles that we want them to use in those hind legs. So you can access all of those videos. So that is actually part of one of my courses called the 7-minute doggy workout. And it works out the front legs, the back legs, as well as the back, the whole body. If you go to drmegankelly.com, you will see that there is an online pet health academy. All the members that are free, there's a free membership as well as a paid membership. But if you sign up for the free membership, you get access to that 7-minute doggy workout. Alternatively, we will be sending out an email where you can just select exactly what you would like to receive from us. And that will be one of the things that will be on the list for selection. So looking at maintaining quality of life, I want to just run through a few environmental changes, some products that can help your pets, and then just a very quick summary on how to exercise your arthritic pet. So blocking the stairs are often a hazard for arthritic pets. First of all, they can fall down them and injure themselves. They don't have the strength often to be able to walk up the stairs properly. So what they end up doing is using all the completely wrong muscles. And especially if pets are very arthritic in their front limbs, when they come down the stairs, it can be very, very difficult for them because they put a lot of weight on those front legs. We already know that they're taking 60% weight on the front and 40% in the back. And when they go down those stairs, it can be very uncomfortable for them. So a little baby gate that you can open and close. I've seen people just put a piece of wood across, or even a mattress or something just to block the stairs. If your dog sleeps upstairs with you, then take them up once a day when they need to go and sleep, but don't allow them to run up and down. You'd rather they save that energy for when you're going to be doing your exercises. All right, when they're eating, this is another time where those front legs really take strain. And this picture actually is not ideal. I actually like a bowl that's slightly higher. And what you want is it to be raised so much that the dog doesn't actually even have to bend down to be able to eat. Arthritic pets, whether they're arthritic in the front legs, whether they're arthritic in their back legs, they are overusing their front legs if they are sore in the hind, so the front legs are taking extra strain, and the extra weight on arthritic elbows and joints doesn't really do them very well. So I would suggest trying to raise the food bowl, and always make sure that the floor where your pet eats is not slippery. So often pet owners will feed their pets in the kitchen, and it's usually a tiled surface, and they have to try and control their legs and prevent them from slipping out to the side at the same time as eating. And you'll often find dogs that will actually just eventually lie down to eat because it's just too difficult for them. If your dog is lying down and eating, please, you need to raise your pet's food bowl. This will really, really, really help them to be able to eat properly and not have to try and worry about trying to stabilize and prevent their legs from slipping to the side. You can put ramps or steps onto the couch or bed. I'm guessing that a lot of your pets sleep on the bed and a lot on the couch. My dogs, they sleep in the bed. And so these kind of sort of condensed foam steps, you can see they're very gentle steps. So it's not a big step because that's pretty much like them going up the stairs, sort of very gentle steps where they can just get a little bit of traction, and it's a condensed foam, so it's got a bit of resistance, and you can just cover it with something. There are lots of great companies that make these products, so have a look out. I'm sure for all of you guys in the States and Canada, you'll find this kind of thing on Amazon. So slippery floors. So in today's day, majority of homes of pets, there's usually some tiled floor or laminate floor or wooden floor. They're easy to clean for us, and we're not so fond of carpets anymore. But the problem is that this impacts on our pets, especially as they become arthritic. There are two things that you need to do before you even start considering about using products to prevent slipping. So if you have wooden, tiled or laminate floors, the first thing I want you to do is to make sure your pet's nails are trimmed correctly. So they should just touch the ground when your pet is standing. So they get traction from two areas. The one is on the nail and the other one is on the paw pad. So you want to make sure the nails are cut. And the second thing you want to do is, you see this picture here with all this hair everywhere. This decreases the surface area of the pads so that they can't actually get traction on the pads. And most of the dogs that have this kind of hair like this is usually the silky, very, very slippery hair. So you want to trim all of that hair. So that's going to be your first thing. Trim the nails, trim the hair. If your dog is still struggling, then you can start looking at products. So these Dr. Busby's toe grips, these work on increasing the grip zone of the nails. You actually can glue them on. I think they're supposed to last about a month or two. And depending on your dog and where they go, these work very well. Nice that your pet doesn't have its whole paw covered. It really depends on your dog. So some dogs, they do better with toe grips. Other dogs do better with other products. And it's really great because we've got such a big choice. So you just got to find the product that works for your pet. Another product is called Sticky Paws. These are like little rubber socks that you put on the dog's paws. These are great. They're very easy to get on and off. You have to be careful. You don't want to leave them on for too long. I think that the actual company says no longer than 2 hours. I've left them on for 12 hours, but as long as the pet is moving, so you do not want to leave them on a dog that is not getting up and down, then I would stick to the 2 hours. If a dog is walking around quite a lot and their blood is flowing, then a little bit longer will be okay. But the one con with these is that because they're rubber, they don't breathe. And especially if a pet has got some skin allergies or problems with the skin between their paws, that's where our pets sweat from. This can contribute to worsening of their dermatitis and can just make their paws a little bit sweaty. But most dogs tolerate these very well. Another option is booties. Now, I like booties that are quite soft and conform to the paw. It wouldn't be my first recommendation for a pet that had arthritis. They're quite cumbersome and sometimes can be a bit tricky to walk with. I think that the thinner sticky paw for me would be better. I use these type of booties more for dogs that are going out for paw protection. But there are some pet owners that find them very useful for slippery floors and made of neoprene, so maybe a little bit more breathable. And the last product that I like is called Paw Friction. This is like a pulverized rubber. So you put a medical grade glue on and then you stick this pulverized rubber on and it increases the traction zone on the paw pads. And it lasts for about 2 to 4 weeks. You have to reapply it again. I had a little dog called Charlie, and I unfortunately had to put him to sleep about 3 months ago. But he lived till he was nearly 20 years of age. And he was arthritic and used to really struggle with the floors. And I tried every single product, and he was very, he didn't like his feet being touched. And he was a rescue dog, and I'm not sure whether maybe his nails had once been cut too short, but he really was, as soon as you went near his paws, he used to try and bite us. And getting these on, the toe grips was tricky. Always getting the sticky paws was tricky, but amazingly, he actually tolerated the paw friction quite well. And we were able to put this on him, and it really, really, I saw a great benefit, and it really helped. So like I said, there are lots of different products out there. You just got to choose the one that works for you and your pets. Another thing you can do is put these rubber mats in your house, maybe not that attractive, but very effective, and they work well. Or even just rugs, just especially if you've got long corridors, if you've got areas where you know that your dogs slip often, make sure that there are rugs there. You'll find arthritic dogs that have lost confidence on walking because they are nervous about walking on tiled or wooden floors will often go from mat to mat, and they'll often lie on the mat because it's easier for them to get up because they can get a bit of traction. All right, choosing the right bed. There are so many different beds on the market. There are specific orthopedic beds. There are a few things about beds, and I like these type of raised beds, especially for larger breed dogs. I think that there's no compression on the pet's joints, because I think what happens in a lot of these beds, especially if they're very soft, as the dog lies there, they start to compress and then it starts to become uncomfortable for them. I think for me, I like it that if there is not a big sort of step that they have to get out. So you see some of these beds that are very high on the sides and they're sort of inside the bed. I like that if they don't have to try and step over something, because especially when they first stand up, they're usually very stiff, and it usually takes a few steps before they ease out a little bit. And we want to make it easy for them to get on and off their bed. Big soft beds like this one, they look really appealing, and when you see them in the shop you think, oh, that looks so comfortable. But if you're arthritic, getting in and out of a bed like this is very difficult. And it's a bit like getting on a waterbed. If any of you have got on a waterbed and got off a waterbed, it is not easy. You feel like every single muscle in your whole body is contracting, trying to stabilize yourself as you try and get off the bed. It's sort of like the bed eats you, it's just sucking you back in. So I don't like these type of beds for pets that have arthritis. So if it's a specific orthopedic bed, those orthopedic mattresses, those are great. And I also don't like ones where they actually can't stretch out. So even this bed here, the dog actually can't put its legs out. So like a flat sort of rectangular bed for me is a lot better. And it must make sure that it's big enough to be able to fit your dog. You don't want to have a bed that's actually too small for your pet. So exercising your arthritic pet, I just wanted to go through a few points. Peter's going to be touching on preventing injuries and exercises that we do with pets. A lot of the time we work all week, we come to the weekend, we haven't taken our dog for the walks that we should have, so we overdo it on the weekend. That's like what we call a weekend warrior. And what happens is our pets start to get so painful because we've overdone it. We've done way too much. So we rather want to do little and often. So if you want on the weekend to take your dog, rather take it for 3 shorter walks or 2 shorter walks instead of one 2-hour walk, because they're going to end up sore. They're going to start to fatigue. There's a strong likelihood that they're going to hurt themselves. I want to promote non-weight bearing exercise. So swimming, always just be very careful when your dog gets in and out of water. There's often stones, especially if it's a lake. You always want that to be controlled. And I would suggest that you also have a flotation device. Some pets are a lot better at swimming than others. If you go to hydrotherapy and your pet doesn't need a flotation, then that's fine. But if you're not really sure how well your pet is swimming, make sure that you just have a life jacket on them just to give them that extra bit of buoyancy. And then going to the beach, especially when there's a lot of soft sand, it can be quite hard for them. This hard sand where this dog is running here is a lot easier, but soft sand is very tricky for dogs to walk in. Their feet are a lot thinner than ours, and if you think even for us, I know when I go do a beach run, I'm usually quite stiff and quite sore afterwards, and it's a lot more tiring. Their feet, they get pushed quite deep into the sand, and they have to use other muscles to try and get their legs out of that little hole that they form from their feet. And that also goes with long grass, as well as, big rocks and boulders and things. You just want to be very careful about them getting injured. So just a reminder again about all the things, and I'm just about finished my talk now, so we're going to I'm going to pass over to Peter just now, but just to remind you all the different things that we want to look at, so it's not just one thing. I have a 12-week strengthening program, which is basically 24 videos. So I've given you 7 of those videos. We have a whole lot more very basic exercises to help with strengthening, to strengthen the muscles that help to support your pet's joints. You can check that out at drmegankelly.com. You don't need any equipment, and you will get lifetime access to that course if you do enroll in it. This is a case study that I just wanted to show you. It was one of my clients, and just to say, I think there are a lot of you out there, you've maybe got a really old dog, and sometimes pet owners will say things like, well, she's getting old and that's just how it is. But just listen to this client of mine, and it's never too late. It really isn't. Savannah's 13 years of age.
Hi, my name is Marita, and my dog is Savannah. She is 13 years old, and she has arthritis in her back legs and her front legs. Especially her one back leg is quite bad. She has been struggling to walk and especially to get up. The walks just became shorter and shorter until we started Megan Kelly's online course. The 12-week strengthening program for arthritic pets and the massage component. And they worked brilliantly for Savannah. She has much better mobility. She appears to be in less pain. She can now manage to walk up to 20 minutes. And before she could only walk about 5 to 10 minutes before being in huge pain. And she is a much happier dog. On difficult days, the massage is great. It helps her get going, and also helps with pain relief. So I can recommend it to anyone who has an arthritic pet, whether it's a young one or a very old dog like my dog, Savannah, it definitely improves their lives as much as possible.
All right, and a special that I'm going to be offering today, I've never done a special like this before. So this is probably the biggest special that I've ever done, but I really wanted to do it for you guys because today is a very special day. Peter and I have been friends for a while now, and we've been wanting to do something like this. And so I thought it's a really good day to offer this to all of you pet owners that have got pets suffering from arthritis. So normally I offer all 3 courses, my massage course, my 7-minute doggy workouts, and my 12-week strengthening program. And it's normally $197, but I'm going to give it to all of you guys for $99. It's for the next 12 hours. If you go to drmegankelly.com, there's the button there, the purple button. You can click on it. You can read all about the courses there. And you'll see there's a timer. So yeah, please take me up on that offer. And as an extra, for the first 30 people, I'm going to give free access to my 3 months platinum membership for my online Pet Health Academy. And that gives you access to all of the recorded webinars, as well as the next 3 months of live webinars. And that's an extra value of $60. So it's a $160 saving. You'll also get access to all my ebooks, which is my acupressure ebook, my osteoarthritis ebook, and my natural ways to manage pain. So yeah, I hope you guys take me up on this awesome offer, and I'm here for you guys to guide you, to help you strengthen your pets, and let's get them mobile and keep them living for longer. All right, so I think that's over to Peter.
Megan, thank you so much for everything that you just said. And you know what I'm thrilled about? I'm thrilled about the fact that we actually haven't really talked about what your presentation will be about. And it perfectly fits in what I prepared. And also what I love is the alignment, like how we see things, which probably will be encouraging and reinforcing to many, because there's so much confusion and so many different opinions about arthritis and mobility. And I just love the fact that we aligned. And I listened very carefully, and I made some notes. And before I go on with my presentation, I just wanted to say a few things. First, there's alignment, but I also love the differences in, let's say, what your experiences are, because I have not seen many overweight pets in our practice in Canada and also in the States. Like I just don't see them. So it's interesting to see the different perspectives. And the most important part that I remember from your lecture is the exercises and also the stabilization of the joints, that many people do not realize that muscles have to be strong in order for the joints to be stable and not loose, because that generates inflammation, friction, inflammation, and arthritis. So that's something that I think everyone should remember. And I love the exercises. I think that everyone will be able to kind of comprehend it, and it was really awesome. Thank you. I'm going to start sharing screen. And hopefully it's going to work fine. Okay, and I'm going to ask Michelle to turn my camera off just to make it easy. You don't need to see me. Anyway, so, I'm going to stop video myself then. So as I said, Michelle and Megan have organized this course, and I'm really happy about being part of it. What I'm going to show you or present to you is a little different perspective at what Megan said. And it's going to be in perspective from the nutritional point of view and also based on my practice experience. It'll probably come all together at the end. So the first thing that I want to remind you that you can be your dog's best healer. The traditional medical model is more dependent on us veterinarians or the other healers. And our goal is for you to learn as many techniques and methods, so you don't really need us. When I left my clinical practice after 20 years of being a veterinarian, my main goal was to teach you how to prevent problems, how to learn to address them without really being as dependent on us. And it's not saying that you shouldn't be going to the vet, but it means that you have to learn, because if you don't learn, then it's very hard to discern and distinguish what is the right advice and what is not. And also, I know from my own experience of living with Sky for 16 years, my dog, that being proactive feels really good. Like the worst part is when we are sitting down and watching our dogs deteriorate and have no tools and nothing to do. So I think that this is going to give you a lot of tools. Just to give you a little bit of background, I grew up in the Czech Republic. I love horses. As a teenager, I spent a lot of time around horses. And that's what basically made me go to vet school. My horse, or at least the horse that was in the riding club that was owned by the government, had tendonitis and lameness. And I didn't really feel like I had a lot of tools to help her. And it was really hard to see her deteriorate. So I went to vet school, and then I felt, after I got Sky, my dog, that I was able to actually relive the life that I couldn't live with my horse, and actually do so many things right, and also learn and learn from my mistakes, so I can share what I've learned with you. As Megan said, mobility is actually the key to your dog's health and longevity. And you know, not only from living with dogs, but also with your parents or senior friends and people around you. You know that mobility is such a key element to quality of life, and that's why it's so important. And I think that you recognize it because so many people, so many of you registered for this course. Mobility is obviously about joint stability, muscle strength, and core strength, but also it is about the optimal function of the body on the cell level and organ level, because everything is connected in the body. It's not just the muscles and joints, it is the liver, and it is the kidneys, and it is the nervous system, and all that kind of jives together. And if it doesn't jive together, then we have issues with mobility. And we know that some mobility issues are not related just to arthritis, but they can be related to central nervous system, they can be related to spinal function and all that. So there is 37 trillion chemical reactions happening in the body every second, which is kind of crazy. Like when I learned this, I was thinking, wait a minute, this is impossible. This must be a typo. And then I realized that it wasn't. And that is why it is so important for us to look at the physical side of mobility, but also the biochemical and energetic side of mobility, and also nutritional. So today, my goal is to really show you a different point of view. And because I don't really like to just kind of say what the problem is, but also bring you a solution, I'm going to be focusing a lot on the solutions. And that's what the past 10 years of my work has been about. I've been focusing not only saying, you know, there's a problem with processed food, or there's a problem with mobility, or this is how there's a problem with kidney disease and liver disease in dogs. I basically worked really hard on bringing solutions that you could use, have the little toolbox that you can open up and say, okay, this is what I'm going to do with my dog to prevent arthritis and mobility issues, but also address them. And prevention is big because it's much easier for you to prevent conditions than treating them. And as Megan said, it is very hard to actually cure, or it's impossible to cure arthritis when it happens. But I think that we can prevent it, at least the onset. We can delay the onset, not by months, by years. And this is what I'd like to teach you. I learned a lot from my dog Sky and my own body. I must say that I never thought that at the age of 54, I would feel the same, or probably better than I felt when I was 30. And it is kind of cool to see that by making our own body an experiment and learning what works and what doesn't do, we can apply it to our dogs as well. And it takes time, and it takes resources and sometimes money to put into the prevention, but it is so cool to see how much more we can extend our dogs' lives. But by doing a few simple steps, we can prevent 80% of the conditions, or at least dramatically delay the onset. This was one of our sessions with Sky. He used to love doing yoga this way. and I would go to the park and he would lie down. But we also would sometimes do yoga together. And this is one of the popular stretches where we did down dog, right? And he would stretch himself and I would stretch myself, and then we would go to all those crazy places and do this together and take pictures. I know that you love your dog beyond anything, and that's why you're here. I also know that you're there for your dog and that you are willing to learn. So these materials will not only be presented here, but also they'll be available in recording. So you don't need to make notes, just listen. The first step in achieving optimal joint and muscle function is injury prevention, because when injuries happen, the dysfunctions that Megan showed are more likely to occur, to happen. Definitely, my first suggestion would be follow Dr. Kelly's suggestions. Make sure that you watch the videos, apply them, and that you also register for courses, because she's one of the most talented and knowledgeable people in the area of mobility and arthritis prevention. The other thing that I would suggest, and I've seen that often, is repetitive, injurious exercise. You know, it really hurts to see these young dogs at the beach and they're unaware, caring but unaware guardians would take the frisbee or the ball and start throwing the ball over and over and over and over. And, you know, once in a while, I actually dare to gather the courage to talk to these people. And most of them are actually really offended that I say that they could possibly do something wrong, right? And then you have to watch these dogs deteriorate. And by the age of 3 or 5, you know, some of the German Shepherds or other active dogs are close to immobile. And I just saw that recently, and it's really hard. So when it comes to repetitive, sudden, jarring, jumping, the exercise that is really out of the natural movement pattern of a dog, because no dog, no canine in nature would be actually chasing a ball for 30 or chasing a rabbit for 30 minutes, right? It would be burst of energy for 1 minute, 2 minutes, but it would not be for 30 minutes, 45 minutes. It would not be jumping and leaping in the waves all the time. So make sure that you remember that any repetitive exercise is actually and can be damaging. Like we know tennis players, right? They get tennis elbows. We know that certain uniform exercise can make imbalances in our body. So focus on a variety of exercise and always think of what would a dog in nature do? Would they sprint all the time, or would they just jog or roam and walk uphill and downhill and through trails? Of course they would. They wouldn't be doing the repetitive one-sided exercise. Too much or too little is harmful. I really love the point that Megan made, that dogs, the weekend warriors or the summer warriors, right? The most exercise injuries happen in spring when dogs are weak and we take them out and they go crazy. So it is super important to remember that most injuries are a result of weakness, but it's also a result of loss of flexibility and impact. And I know that some of you most likely suffered some injuries. And when I see my friends and even myself, if I pull something, I go, okay, I'm getting weaker and I'm getting tighter. So it is a combination of strengthening, but also increasing flexibility and stretching and massage and body work and all those. I put these links in the presentation because you will be able to see this article. So this will tell you how to know if your dog is injured and also what exercises to prevent and avoid. I'm going to go back here. Neck injuries. You know, neck injuries are super common because people, once again, most of them unaware, use choke chain, martingale collars, tightening collars that impinge the nerve lines to the front legs. And they impinge not only the nerve lines, but they also make the muscles tight. And when the muscles are tight, Megan explained that the blood vessels get also impinged. And then there's lack of flow in the front legs. Dogs start licking their paws, or they start having arthritic issues, inflammation, muscle tightness, and all that. So the whole cascade starts happening. Ideally, avoid these tightening collars. Ideally, avoid retractable leashes, because when you press the brake, there's a big jerk and micro injuries happen every single time you do that. Avoid attaching leash directly to collars, especially in dogs that pull. If your dog is an absolute angel on the leash, maybe you can use the leash on the collar. And I sometimes used it with Sky. But dogs that actually are, let's say, happy to welcome another dog or say hi and start pulling, just on that occasion, they can suffer injuries. When I was trying to solve the leash/collar issue, I accidentally ran across a leash that is made of wool, believe it or not. And it's stretchy and it's really strong. And I tried to break it once, and I could not break it myself. But the lovely thing is that it actually stretches and absorbs the shocks. I stumbled upon it on an island nearby Vancouver, and the lady who makes them actually makes them by hand. And they're my favorite leashes. And every time I give it to someone, they just don't want to use anything else, and then just hope that they get another gift. Of course, you can buy it on the store, but maybe what we should do, we should actually draw one person today to send them an absorbing leash. Harnesses are the replacement of collars. It took me about 5 different designs to discover the ideal or close to ideal one. The harnesses that are out there sometimes impinge the muscles behind the armpit of your dog, and it can be a problem, right? So there has to be enough space. And when there is tightening or impingement, again, that can lead to a whole cascade of problems, including arthritis. I love to put the leash or attach the leash to the front, because if you do so, if your dog pulls, there is no pressure on the front structures of your dog's neck, including thyroid, blood vessels, and nerves. It's relatively easy to measure your dog. You can just click to measure, and then it kind of explains everything. You just take the first measurement and the second measurement and so on. So we worked really hard to give you the tools to be able to prevent neck injuries and collar damage. Body weight. As I said, I have not seen many dogs with body weight issues, but there are some ways of determining whether your dog is too heavy or not. Some people say, well, how much shall I feed my dog? Like, what is the right amount? And the right amount is the kind of amount of food that gives your dog the right body condition. And what do? You feel the ribs, count the ribs. You have to be able to count the ribs. If you cannot count the ribs through the hair, and you cannot say 1, 2, 3, dogs have 13 ribs, by the way, your dog is most likely too overweight. If you bathe your dog, if your dog has long hair, and you can see the ribs, visibly see the ribs, then your dog is too thin. If the hip bones are prominent, again, most likely too thin, but also possibly muscle wasted and weak, right? So it may not be always a body weight issue. Sometimes it may be a muscle wasting issue. So be careful to distinguish those. And the backbone should be nice and rounded. It shouldn't be sloping like a roof. Again, it can be muscle weakness, but quite often the dogs that look like a little night table, like when they're standing beside your bed, you can put a little coffee mug on. That would be a problem, right? I've seen those dogs in the past. Again, there is an article on how to determine what the right body weight is. And there's a little table here, as you can see. Feel the ribs and thin, optimal, and overweight conditions. So you can just click on that. And I know that Leah, one of our team members, is sharing these links with you as well on Facebook Live. So going back here, and obviously, it comes without saying that kibble is actually the primary cause of obesity because it's so carbohydrate rich. And even when it's carbohydrate free or not free, but grain free, it still processed food seems to kind of mess up the metabolism, and dogs often gain weight. Injuries affect not only joints, but also blood flow, nerve function, the meridians, the energy meridians of your dog's body, and muscle tone. Now, when it comes to body work, I think that every single one of you should have a body work practitioner in your dog's caretaker or practitioner group. There are several different options. Obviously, your veterinarian should be the primary point of contact, but let's be honest, many vets have not been trained on mobility and arthritis and exercise. So they will not ask you the basic questions. And I hope that this webinar will ignite the discussion and the conversations. Chiropractics is amazing when it's done by the right person. I worked with chiropractors for many, many years, since early 2000, and I've seen most of them doing a fantastic job, and some of them, because they have not been trained properly in dogs, use the same techniques as on humans, and they can really hurt dogs. Like, I've seen that even with my dog Sky. When I left Vancouver and I was in Maui, I had someone doing adjustments, and within 2 weeks, Sky was twice as bad as he was before. Physiotherapy, amazing. Strengthening, again, Dr. Kelly was talking about that. Acupuncture, releasing the muscle tightness, which is also related to intramuscular needle stimulation. When you insert the needle, I see it as a reset, right? When your computer freezes, you reset it. When your dog's muscles freeze, you reset them by putting a needle in, and the muscles, it's a reflex, the muscles relax. Homeopathy can be amazing addition to our arsenal as well, and a homeopath. But homeopathy is sometimes misunderstood. It is not that you prescribe that remedy for that condition. It has to be prescribed for the whole body, because muscle tightness can be due to an injury, due to an emotional problem, due to stress, genetic predisposition, and the homeopath has to take a proper case analysis. And I've practiced homeopathy for the last 20 years, and I know that it has been misunderstood, because people go to the drugstore and they would take a pill for, let's say, back pain or stomach ache or headache, but it doesn't work like that in homeopathy. Massage, amazing, and hydrotherapy, I can't say enough. The reason why Sky was mobile until the very end of his life, even though he did have at the end tightness and arthritis, we extend his mobility by several years just by doing the massage and chiro and physio and hydrotherapy, and definitely underwater treadmill. So just remember that not all mobility issues are actually related to arthritis, because there may be circulatory issues, heart issues, there can be tumors, there can be other issues that you really have to rule out before you assume that your dog has arthritis, because not every mobility issue is arthritis. I was telling you, or I told you at the beginning, that the body has to function on an optimal level, because if it doesn't function on an optimal level, then it cannot rebuild, it cannot heal, and it cannot, the muscles and the 37 trillion reactions a second cannot happen as easily if there are toxins, right? Because they're like disturbing guests at your party that you don't want to have, right? So the toxins are in our environment, and you can't really prevent exposure, but what you can do is to eliminate them. Toxins, and you probably know that if you ever go to a wedding or party and the next day you wake up and you feel a little achy and not well. Toxins are leading to dysfunction and inflammation. And toxic elements, interestingly enough, can compete with the good elements. So they push out the good elements that are helpful and take their place. And it's super important to know that the liver is the biochemical mega factory of your dog's body and your body. So if it's not working well, or if it's toxic, nothing functions as well. I've brought two different solutions to you when it comes to toxin testing and toxin elimination. If you do blood test, you will have a snapshot in time. Let's say if I get up this morning and I would do blood test for mercury or for arsenic, it may be that I had rice noodles last night and I have higher arsenic levels because of the rice noodles. You can actually read about that on my blog as well, why. But if I do hair test, it gives me a snapshot over 4 months, 6 months, because the hair grows out and it locks in the minerals, and we can analyze it and see what the toxin levels are. I'll show you some results here. These are results from one dog 1 year apart. And obviously, nutritionally, something changed, because you can see that the arsenic level, toxic elements, is higher 1 year later than here. And one of the possible causes can be rice, because rice is grown in Eastern, in Asia, and the water pollution is a very serious problem. And you can see that we had no lead here, and suddenly we had quite significant exposure to lead. You can also see the other elements here, and you can see that there is a high level of manganese right here. So something is going on. There's probably unbalanced supplementation with manganese, or the body cannot or doesn't know how to regulate these minerals as well, right? Like, it's nutritionally, this dog was on actually artificial synthetic supplement. So I can tell you that. There's another interesting kind of element in hair testing. In 2011, Fukushima disaster happened. Most dogs that have been on sardines started having elevated levels. Within a couple of years, I started seeing these elevated levels of strontium. And strontium 90 was released from Fukushima in the water. And unfortunately, there are a lot of sardine brokers in Japan that distribute sardines. They freeze them and distribute them all around the world. And it is possible that the sardines that you buy in North America and would be sold under a certain brand may have higher strontium 90 levels. The interesting part is that the reason why sardines or small fish are much higher or greater risk when it comes to strontium is that the fish is eaten with bones. And strontium competes with calcium, so it deposits in bones. And then when we eat sardines, it will elevate our levels of strontium. Obviously, I'm not saying that every sardine has this issue, but it would be interesting if you're feeding your dog sardine to actually do hair tests and see where you're at. Conventional drugs are foreign substances, therefore I consider them toxins, and I try to eliminate them as often as possible. In fact, very rarely I would use any NSAIDs because they too are toxic to the body. And the other problem is that inflammation is a part of the signaling system in the body, that there's something going on, right? And inflammation can be, in the early stages, can be part of the healing process. Mild pain is good to signal, right? Like, if there's mild pain, it is a signal to rest. Obviously, if there's moderate to severe pain, we need to address it. But there are other ways to address it than giving drugs. Because, if I give a drug and if I say, okay, my dog is now not lame, but he's got kidney disease, because I've seen that over and repeatedly from NSAIDs, then it's a problem, right? It's like flying on the plane and say, well, like, I saved the engine, but the wing is going, right? That would not really be the right solution. And I think that in medicine, quite often, we actually reach for a solution that causes other problems. And the side effects of these drugs are actually effects that are just labeled differently. So just remember that. So would you sacrifice your dog kidneys for his or her joints? I wouldn't, because I know that kidneys are as important as the joints, right? So there must be other solutions. Drugs are tempting. And the other day, I was talking to my assistant, Angela, and I was saying, it's so weird that people are all holistic. And when they really need to kind of stick to the guns and be holistic, they reach for the drugs, whether it's about their own pain or their own headaches or their dog's pain, right? And there are other methods. And this is what the webinar is about. Because you would not take a sleeping pill to fight a fire, right? Like, you wouldn't take a sleeping pill. You would actually take the hose. And the drugs are the sleeping pill for your dog's body, for your dog's healing, for your dog's signaling system. So liver cleanse is another method of eliminating your toxins from your dog's body. And there's an article on liver cleanse, so you can go to my website and type liver cleanse, or also search in the comments of our Facebook Live. And I'm sure that Leah is posting the information there. So now we're to the fourth section, and that's nutrients. Nutrients are abundant in nature, at least the nature that used to be. I love going to Africa. I've been twice, and I feel like I love to live. But now when I see Africa, I'd be content dying because I've seen the most amazing miracle of this planet, because the cycle and recycle of nutrients is really clear there, right? The animals feed from the ground, from the land, and then they grow, and the carnivores eat the herbivores, and then when it's time, the carnivores feed the land again. But what we've done in our modern world, we transport food and all the wealth of this planet from one place to another, and the cycle is interrupted, and our soils are depleted. And I didn't really know that. I didn't really realize that the problem is as severe until I started doing hair testing and learning that there was a serious problem with deficiencies. And I find the essential nutrients as important as the joint supplements, because without the essentials, the body cannot function properly. The body cannot conduct the 37 trillion reactions in the best possible way. So you can see that I put the nutrients beside the joint supplements, because I find that the nutrients, the essential nutrients, are the engine to the body, and the joint supplements can be the wings, right? They carry our dogs forward. So the 4 essentials are super important in arthritis prevention and repair. And the 4 groups are minerals and amino acids, and then vitamins and organ supporting nutrients, and omega oils and probiotics. And I'll tell you a little bit about each of them. We don't have as much time, but remember that the good minerals can occupy the receptors in the cell to prevent the toxins and toxic minerals settling down in the receptors. So if you have a full flight of good minerals, okay, you cannot really board anyone else. But if there are deficiencies, then the toxins can harbor. So you want to make your dog's flight totally oversold, okay, or a little bit oversold, because what you do, you actually provide smorgasbord of nutrients, and your dog's body, when they're natural, can choose what it needs and store, or throw off what it doesn't need. This is an example of competing minerals and elements. You can see that calcium competes with lead. Iron competes with lead and mercury. And when the ratios are acceptable, that means that we have actually good ratio of the good minerals in regards to the bad minerals or toxins, okay? So you can see that selenium competes with mercury, zinc competes with cadmium and mercury and sulfur competes with cadmium and lead as well. So this is actually one of the results that you would get if you run hair test on your dog. Vitamins. There's a lot of problems with vitamins because most of them are synthetic and they're made in China. I have been determined, and it caused us a lot of problems at the beginning, determined not to source any ingredients from China. And it was super difficult because we just had a hard time to actually source ingredients. But we did it, and we actually have built or put together, formulated, fermented vitamins that are whole food based. Now, you cannot really, economically, you cannot really get carrots and oranges and apples and make vitamin supplement. I counted it once, and one pill would be into hundreds of dollars, right? But you can take the vitamins and you can ferment them through probiotic culture, and they become food. So they're actually much more readily accepted by the body. The body goes, oh, this is food. They're also regulated better, so hypervitaminosis are not likely. And the whole food based supplement is also organ support. I made sure that I address some of the most common problems in dogs: kidney disease, liver disease, inflammation. Asparagus is really good for toning kidneys. Dandelion is good for cleansing the liver, and turmeric is good for inflammation and cancer prevention. So when it comes to soul food, it is different because it is not only whole food, but it's also certified organic. And you can find all the information on the website. Again, Leo is going to probably post the link very shortly. Now, probiotics. Again, it is important to remember that arthritis and inflammation is connected to the immune system. And when we don't have the right or immune function, and when the immune system spits and sputters, it does affect our dog's joints. And it is super important for us to condition the digestive tract through good non-dairy fermented dog-specific probiotics, because dairy is actually one of the causes of inflammation and arthritis in our dogs. Dogs are not supposed to get dairy. So if you have an arthritic dog, it's super important not to give any yogurts, any milk, any cheeses, because that will aggravate your dog's condition. You know, before I go on to the next slide, I have my own experience with inflammation and hay fever when I was a teenager, and diet addressed it dramatically. If you feed your dog right, if you get your dog off kibble, if you feed the right probiotics, if you avoid certain groups like grain and milk, you're going to see huge improvement on your dog's condition. Now, EPA and DHA are omega-3s. Omega-3s are another kind of difficult group. It is relatively simple product, omega oils, but it is hard to source sustainably. And it is hard to make sure that you get the right non-toxic source, because we have pollution in the oceans, we have mercury, we have strontium, we have GMO materials that most of the plant-based oils, whether it's from algae or plankton, most of them are GMO, because we tried to source plant-based supplement and we failed because we could not find any reliable source that would not be GMO. And I was shocked when I discovered this, because there are all these companies that sell algae-based oil, and I thought that it was all kosher until I discovered that it is GMO, or most likely GMO. So if you want to learn about omegas and omega oils, you can go on the site and you'll see that the only really sustainable source of omegas is calamari or squid. Because there are fewer fish, calamari is not eaten as readily by fish, and they're growing in population. So we're actually helping the environment by reducing their numbers. I was so thrilled when we discovered that. And also that squid is actually very low in toxins. And we have third-party testing as well. So we've done testing. It was one of the hardest things that I've done to source the right omega. And I do take it as well. Anyway, I know that time is running. I'm going to go to the joint-specific supplements, the wings of your body's arthritis plan. I would recommend starting early because most dogs do not show any clinical signs, but the biochemical changes and the structural changes may be happening a few years before. 5 to 7 years is my suggestion. Maybe Megan can actually give us her opinion at the end of the lecture. And it's also super important that you should be choosing whole food-based supplements. Again, when you give the synthetic supplements that are chemically made, they're not the same. It's like taking a plastic apple and real apple, right? It's very different thing. The body may respond to a degree, but it will not respond the same way. I've seen problems with synthetic supplements. The next few slides will show you some of the common and less common ingredients that you should be looking for supplements or in supplements. Looking for in supplements. Sometimes my English gets mixed up a little bit. Obviously, glucosamine, chondroitin, and MSM are some of the most common ones. I found the effect mild to moderate. I've never seen major effect from these three ingredients. And even research says that they may have mild to moderate effect. I've done some reading before this presentation just to kind of see whether anyone has different opinion. But clinically, I've seen mild to moderate changes. When it comes to sustainability, chondroitin quite often is sourced from shark cartilage, so you have to be careful. Or even marine cartilage, it is sourced from another fish. I forgot the name, but again, we don't want to use unsustainable sources of our supplements. Green lip mussel is a mussel that is very abundant in New Zealand, and it is also part of the aquaculture of New Zealand. And I've seen very positive effect on inflammation. It is whole food, and it is a source of ALOX5, which neutralizes the arachidonic acid. And arachidonic acid is actually the omega-6 acid, which you find in meat and you find in other foods. It is inflammatory. The funny part is that most people don't realize that omega-6 is actually inflammatory, and all we need to worry with our dogs is to give enough omega-3s. Green lip mussel, whole food, sustainable, and it has moderate effect on your dog's joints. Turmeric, another one. In some of my blogs, I recommend turmeric-based supplements. They appear to act on the same receptors as NSAIDs, but I have not seen the same side effects with regards to liver and kidneys. So they are a very reasonable choice. Research does show positive effect, and some people have been using golden paste, which is a mix of coconut oil, turmeric, and pepper. Now, I'm not too big of a fan of large amounts of coconut oil and turmeric or golden paste because I've not seen as much of an effect as I would like to. And I've seen some issues with pancreatic enzyme elevation when these dogs get a lot of coconut oil. So again, be careful. You may actually use regular high quality organic turmeric in your dog's food. And we have some blogs on that topic as well. Ginger is another really interesting food ingredient. It has shown clinical difference and changes and positive improvements in dogs. And it also is warming because some joint conditions in arthritis are in Chinese medicine related to the dampness of the body. And ginger is heating or warming. So it is a good ingredient to add to your dog's food. Stinging nettle, very traditional European herb. My grandfather was a herbalist, and he used to collect herbs, including stinging nettle. It does show some clinical effects on joints. You can add it in your dog's food as well. Some people traditionally use stinging nettle just by producing that stinging reaction around their joints, and they say that would help as well. I haven't done it, but that's the history of it. Boswellia, you will see Boswellia, which is a tree. You will see it in several different supplements as well, and it does reduce clinical pain and discomfort by 32 to 65% based on research. Vitamin C, again, if it's synthetically made vitamin C, I don't really like giving too much of it. But if it's in a whole food form, fermented supplements such as soul food, obviously it's a different story because the body knows how to manage it. EPA and DHA, I actually made a mistake here. It should be in joint supplements as well. So it's a dual use here. It's an essential nutrient because the body cannot make it itself, but it is also super important in reducing inflammation. And some studies say that it is as effective as NSAIDs without the side effects. So super important for you to give omega oils, omega-3s. Now, CBD oil. Everyone talks about CBD oil, and I started being very interested in CBD oil when I put a few of my patients' and friends' dogs on CBD and started seeing this really arthritic, inflamed dogs moving again and being happy and all that. The challenge has been that we still don't know what the long-term effect of CBD is and whether it has any effect on liver and other organs. So we are actually planning a study of 25 dogs in the Vancouver area that is going to be clinical study. And then the rest of you will be able to join in and we'll give you recommendations and you'll be reporting the results. So we are hoping to actually get much more information and see if CBD oil or cannabinoid is actually a viable option for addressing arthritis. Now, the good news is that CBD can be sourced from hemp, which is absolutely legal. And cannabis is becoming legal in many countries around the world as well. But I have used the CBD from hemp. It is the same ingredient, just different plant. So it is super important for you to start early. Like it's not like you're going to be waiting for 5, 7, 10 years and then you go, okay, I'm going to start with arthritis prevention, arthritis treatment. You really have to pay attention to all these different elements, to these 5 different points from the start of your dog's life. When you're deciding what kind of exercise to do, when you're taking your dog for hikes or walks, when you're thinking about taking your dog for a bike ride and going our crazy downhill, right? And your dog is trying to keep up because he doesn't want to lose you, but injuries happen. So really think about what dogs would do in nature and start early. If you are on Facebook Live, what I'd like you to do is to go to the link and register because we'll be sending you the course recording and website info and learning materials and everything else. And you can also get updates from us. Oh, and then there is a feedback here. So thank you so much for listening. And now we are going to the Q&A section. I know that I was a little longer too. It's hard to actually stop talking about this topic because it's such a big topic, but also so important. So I hope you're still hanging in there. Thank you so much. Leah, are you there?
Yes, can you hear me?
Yes, we can hear you, yes. So you're live, and Dr. Kelly is going to come in a moment. So maybe questions for me, if there are any. And Megan is going to log in again.
Sure, you bet. So first question I've got is from Susie, and she is asking, Dr. Dobias, how do you feel about plant-based omega oil for dogs? It seems to be a trend.
I did talk about it. We failed to find non-GMO source. I'm not saying that there is not any non-GMO source, but I think that there is a problem. Second problem is that if some of the plant-based oils are sourced from the ocean, if we harvest and overharvest certain, let's say, krill or something else, plant-based oils, we can actually disturb the chain. So it's really important to have it sustainable. And second, I feel a little uneasy about plastic pollution in the oceans because there are these microparticles and it would be hard to sort them out and filter them, right? If I have the squid or any physical body animal can actually filter out these particles much more readily than when they're kind of collected with the plankton, right? Or the algae. So that's a little bit of a concern. But again, my biggest reason was that I did not find non-GMO source.
Here's a question. I've tried giving my dog turmeric in his food and he has diarrhea. What should I do?
Okay, turmeric and diarrhea. First, make sure that you go through the cleanse diet, making sure that your dog's digestive tract is good. And if you looked after those elements or segments, make sure that you start gradually. Start with maybe 1/4 of the dose and then increase. Leah, are you there? Leah?
Yes, I'm here.
Okay, great. Megan is back, so we can maybe go with some questions for her.
Okay, let me get to the top here. Gwen is asking, I would like to ask you if collagen is good for arthritis and if it is safe because my old German Shepherd has underlying cardiac disease. She's got some specifics on that and just looking for some advice on if collagen is good.
Megan, would you like to answer that question?
I think it's more your department, eh? You probably know more about it.
Okay. I like collagen is part of obviously the joints and cartilages, and I like feeding the building blocks to our dogs, right? So I'm not necessarily saying that it's wrong. It would be good. I think that you're going to provide your dog the essentials from the nutritional point of view. I do not think that I have not seen any clear effect of collagen, like feeding collagen equals better lower inflammation or better signs or improvement in arthritis. I haven't seen that. But I would say that it's fine. But if it comes to collagen, let's say from a supplement, I'd just be giving cartilage and bones, chicken bones, right? That's the best.
It is starting to be added into quite a lot of joint supplements that companies are making. And I think they're trying to add it into some of the dog foods too. So I think it is sort of a new fad. It
may be. It is not necessarily against the nutritional kind of guidelines, but I wonder whether it's used as a filler because it's probably cheap. And I still think that good organic chicken cartilage is much better than synthetically or processed collagen, let's say.
So I think that's where most of the companies are sourcing it from, chicken sternums, I believe.
Yes, and again, I like to have control over the quality of the ingredients as much as possible, meaning that you never know where the chicken came from, whether it was organic or not. So again, whenever you can reach for whole food, you can. But when the whole food is depleted because of soil depletion, then you have to actually reach for the compromise. In the ideal world, we would not need to supplement any supplements, okay? But we have messed our planet up so badly that we need to. And I've seen the results if we don't and if we do. And you can also read some of the opinions and testimonials on my website, because you will, sometimes I read them and I go, wow, I never expected that it would have such huge impact. And now I kind of expect it. But at the beginning, in the early stage, I was shocked actually how many problems are related to deficiencies and toxicity. It's unbelievable.
I've actually found a question for myself. It is from Patricia. She says, my dog has a torn cruciate and arthritis. What do you recommend for rehab? We do water therapy, but it's hard to get up from a standing position. What can we do at home? Patricia, it really depends on how long ago the cruciate ruptured, and whether you're treating it conservatively or whether you're treating it, your pet has had surgery and you're doing rehab after surgery. Usually, if it's a conservative approach, it usually takes about 12 weeks of conservative treatment. And normally you would do this together with the rehab therapist, which sounds like you're doing. The water therapy of choice for cruciates is underwater treadmill, because the muscles that actually help to support the knee, they need active weight bearing in order to contract and to strengthen. And if we don't build those muscles up, the knee becomes more and more unstable, and then our conservative approach or treatment doesn't work well. In my clinic, what I would do is give a dog that has a conservative treatment 1 month. And what I want to see is that there's improvements in the muscle mass. So we take a measurement of the muscle. I want to see there's improvements in weight bearing and improvements in lameness and improvements in pain and the ability for that dog to be able to straighten its leg. If we're not seeing those improvements, then I would normally recommend surgery. There's probably a meniscal tear or something like that. If you are doing it after surgery, so you're rehabilitating after surgery, most pets that have a cruciate rupture are also on a 12-week program. It is very dependent on how severe the arthritis is already in that joint, whether there's other areas that are arthritic as to what you'd be doing. But what I would recommend is that whoever you're going to the water therapy, whoever's doing your water therapy, whether it be swimming or underwater treadmill, for you to just get them to do an assessment and to give some specific exercises that are targeted for your pet. These basic exercises that I give, that's 7 exercises. Some of them, for example, like the leg lift would be very difficult, I think, for your pet, considering that it's already struggling from the sit to the stand position. So I really think that you need to get a rehab therapist involved here just to guide you and specifically target it at your pet.
I think that Leah has more questions. I have a feeling. Leah, what is your next question?
Yes, the next question is also for you, Dr. Kelly. Liz is asking if my Yorkie already has a weak right side of her body and she is 16, will the exercises you recommend help?
Can you repeat that, Peter?
Yeah, if so there's a 16-year-old Yorkie, and I believe he has right side weakness, and she's asking if it was okay to start the exercises and if they would help.
Yeah, I think it would also depend on what the diagnosis is, so what the cause of the right side. So if it is arthritis, yes, in those basic exercises you would be able to start. But I think you just want to make sure that there's nothing neurological going on there. If the whole right side is weak, there might be a neurological component which might be sort of from higher up in the neck. So I'd make sure that you have a proper diagnosis before you start the exercises.
Great, thank you. I'm gonna plug in microphone because someone started cutting grass here, so I'll just try to see if I can eliminate it. Leah, are you there? Another question?
Yes, we have a couple people asking. Their puppies are 1 year old, and they are wondering if you recommend the hair Q test for them for as young as 1 year.
Yes, actually. Oops, I dropped it. We usually recommend hair key test starting at the age of 1 year, even though it would be very interesting to see whether puppies, let's say 6-month puppies, would, what their toxin levels would be, right? It tells you a little bit about their mother, but usually it takes about 4 to 6 months for the turnaround. We usually trim the hair from the from the skin up about half an inch or so. And that would mean roughly about 4 to 6 months of timeline. So yes, so 1 year is probably a good time to start. It'll give you an idea what your dog is missing and what toxicity there is. And quite often I just go, if I see some sort of element that is elevated, I go on the internet and see what the sources of those chemicals are. And often we can link it to garden products or some sort of local pollution or rice or fish, sardines, fish oils and all that. Leah, are you there?
Okay. Yep. Okay. Another question for Dr. Kelly. How long do you do the exercises that were shown? Do we start at 5 minutes?
Yeah, so if they if they sign up at drmegankelly.com, they will get the full course and it'll explain the progression of how they should be doing the exercises. So for example, with the weight shifting exercises, we would start with...
Yes.
Right? We'd start at going from left to right 20 times, and we would do this twice a day. There's a whole downloadable exercise sheet, so it'll show you the progression that you should be doing with all the exercises, how many you should start with, and sort of how you can make them a little bit more difficult and more challenging. So if you just go to drmegankelly.com and just sign up for the free online Pet Health Academy, you'll get access to that 7-minute doggy workout course, and everything is there, all the instructions.
Thank you, Megan. Leah cannot hear us because I have a headset, so I'm just going to be kind of like serving as an intermediate element here. We're going to take 2 more questions, and if you have any more questions, we are going to do our best to answer them either through email or on Facebook Live. So we'll try to make sure that all the questions that are on those platforms will be answered. And forgive us if we won't do it right away in an hour or 2, but we'll do our best to actually respond to you. Leah, what is the next question?
The next question is from Sally. What are your thoughts on her understanding that coconut oil and black pepper are necessary for the biouptake of turmeric?
I know that based on the research that has been done, that pepper actually does promote and enhances the anti-inflammatory properties of turmeric. And when it comes to coconut oil, again, like I think that it is a helpful ingredient for many reasons. I'm not necessarily saying not give it at all. You can, but I do not think that coconut oil replaces omega oils, because it is not an omega. It's a saturated fat. It is not the same. And I think that people kind of reach for it a little too often than I would, meaning everything in moderation. And when it comes to coconut oil, it is not the miraculous ingredient that I think some people see it. It is a great source of energy for the nerves. It is a great source of energy for the body and the muscles. But I have not seen the kind of improvements that some people are saying that they should see. So I'm a little careful about saying, for sure it works beautifully. I have not seen that. How about you, Megan? Have you seen coconut, the golden paste working?
And I've seen some cases where the golden paste has worked, whether it's from the coconut oil or the turmeric. My gut feeling is it's from the turmeric. But coconut oil itself as a supplement, I'm not convinced about.
Thank you. Leah, Megan has finished.
Okay, so the last question, this one is for Dr. Megan as well. I have a 10-year-old male standard poodle who is having trouble getting up, pushing those back legs up. Once he is up, he can walk okay and can stand. I purchased your courses today. Will the 12-week program help him? Any additional recommendations that you have?
Thanks. Yeah, that's a great question, because often that's how the pets are. They just struggle to get up from the lying down position. And what I would really recommend is you make sure that wherever your pet lies down, that the floor that they are getting up on is a non-slippery surface. And if you need to, you can actually put a rubber mat underneath your pet's bed, so that when your pet puts its feet off from the bed, that there is a area where they can have traction. The other thing that you can purchase, there are harnesses that have handles on the front and handles on the back, which you can use in the interim, just to give them a helping hand up, because you want to be careful when they're getting up and they're weak like that. You don't want them to slip and hurt themselves. The exercises will definitely help. You must follow the program week by week. You are able to communicate and email with me, so please send me an email. I'll send you some links to some harnesses that I think will be able to help you until you can build up that strength, and just take the exercises slowly week by week. And yeah, just keep up to date with me and let me know how things are going, and I'll assist you.
I think time is up. Megan, is it right?
Yeah.
What do you think?
We're on about 2.25 hours now, so I think we've gone really over time. So I just want to thank Peter and Leah and the whole team. Thanks for your support, and Peter, thanks for agreeing to do this awesome webinar. While you were lecturing, I had a little chance to scroll through and see all the awesome comments. Thanks to all the people that are here for the actual webinar, and all the people that are supporting us on Facebook Live, and all the amazing comments and your hearts and thumbs up. We really, really appreciate it. And put all your comments there, and it's about 10:15 at night for me, so I'll be answering your questions tomorrow, so probably not tonight, but yeah, thank you for everyone that's attended, and hoping that everything that you've learned today will you be able to put to good use, and let us know, please let us know all the improvements that you're seeing from everything that you've learned today.
I would like to thank everyone as well, and Megan and Michelle and Leah, and especially you, just caring for your dogs and loving them, and striving to learn, but also sharing the information. And really, I really strongly believe that our dogs come to us to teach us, not only about how to keep them happier and more mobile and having them better quality, getting them better quality of life, but if you apply what you just learned about your dog to your own life and your own body, I think you're going to see such an improvement. And, the back pain and the torn ligaments and all these injuries will be reduced dramatically. And I'm going to close by a sentence that my yoga teacher, a very dear friend, says. She always says, I don't know how people who don't do yoga don't do yoga. So anyway, stretch, massage, do everything for your dog that you can, have you learned, and don't forget about yourself, because your dog wants you to be able to walk and be happy, because then our dogs are healthier and happier. So thank you so much.
Cheers, everyone. Thanks for the support.
Bye.
Cheers, eh?
Bye.